Tara Nipe. I'm a clinical nurse specialist at the Alfred Hospital and I'm coming up to 24 years there.
And my name's Chris Morgan and I work at Frankston Hospital and I'm an enrolled nurse with 11 years experience there.
So our last campaign was in 2007 and that was under a Labor government who'd just come in. So we won them in 2000, we had to fight for them in 2001 and 2004 and 2007 and then 2011. No government understands how ratios keep nurses and midwives practicing, how they improve patient outcomes, how they reduce cost, reduce nursing sensitive outcomes.
Ratios are so important. In Victoria we said it wasn't about our pay. Of course we wanted a little bit more pay. We all wanted a little bit more pay. But it was about our ratios. The key thing that kept me going through all of the ups and downs, and I believe was responsible for the success of our campaign, was our solidarity. You must stick together. Look after one another. It is so important.
This isn't a nursing issue. This is something that affects everybody who's in a hospital or that could be admitted to a hospital or has family who could be admitted to a hospital. And that's all of us, because that's what it's about. We're not just protecting our patients, we're protecting our families and ourselves. Any of us could end up in hospital. I picked up 3 big things from the campaign. The first is social media is vital for keeping people informed, for connections, for planning things, for making sure that when people are feeling flat, you can post something to boost their spirits.
One thing that I would do, because I too was sanctioned and I couldn't talk because I was facing a $6,600 fine, is that I would go and visit one of my sisters or my nieces or a relative and I'd say, can I please use your Facebook site? And they'd go, yeah, what's going on, Anna Chris? And I'd have a little cry, and they'd give me a cuddle. I've been sanctioned, I'm facing $6,600 fines, and they're like, quick, use my computer. Everything that we did it together. We informed one another through Facebook, through text messages, through phone calls, through just a pat on the back. Are you okay?
The second thing is you can do more than you think you can. Just push yourself a little bit.
We were everywhere. 70,000 red shirts were distributed. That's pretty good, honey. And they could be seen at the cricket, the Australian Open, Carols by Candlelight, on Facebook and on Twitter. Well, we had fire engines and ambos. Mine's very tattered because it was on my car for 9 months, okay? So everybody, the community all had those flags on too, and truck drivers and so forth would be honking their horns at us. And it was terrific to have those flags. We had celebrity supporters like Pat Rafter wearing the red shirt at the tennis, Jimmy Barnes with a bandana during a performance. Unfortunately it rained during his performance. He was outdoors and the red dye came out onto his beautiful white shirt. Wasn't a good look. And several others joined in our marches or posed for photos. Our biggest march through the Melbourne CBD to Parliament was attended by 10,000 protesters. It was fantastic.
So it was a rally with huge public support.
Yeah.
And then we started with bed closures.
I closed the first bed at Frankston. Before doing this, I ran into the emergency department and spoke to the floor manager and said, is anyone coming to AMU? And they said no. And I said, are you sure? Please, can you just look, have a really good look? And I was shaking already. I'm going to shut a bed. Are you sure? Yeah. Okay. No one. I went back to my ward and one of my patients was being transferred upstairs, so I popped them in a wheelchair, got all their belongings together. The PSA was going to wash the bed and I said, here's a sign I'd like you to put on the bed. You're closing the bed? Yeah. I got to the lift and guess what? There was another nurse there. She said, are you Chris Morgan? I said, yeah. Did you just shut a bed? I said, yeah. Oh, wow! And she embraced me. I did it. I'm proud of that too. And Mum would be too, and she's a former nurse.
I want ratios to be everywhere.
Just as important to maintain, to keep our nurses and have nurse retentions, but also for patient safety, and that's paramount.
Knowing my patients were okay and remembering what I was doing was for them was on my mind all the time. Because I can't look after 6, 8, 10 or 12 patients. There's just no way. And that's what the Liberal government was proposing.
So the Health Minister came to launch a new policy, and the story was, so Chris managed to gather about 30 people in shirts.
No, 50 people.
50, I do
I had a
apologise.
30-minute warning that he was arriving.
David Davis, the Health Minister, visited Frankston and thought he might just slip in unrecognised.
David Davis, the Health Minister of Victoria. I know who you are. Stop. And he turned around and said, "Oh, what is your name? How can I help you?" And I said, "Just talk to me after whatever it is that you're doing here." So in that time, he went into some office and came out. And there were 50 of us, at least, in red shirts. And we cornered him, and he was totally flabbergasted. And that was wonderful. Not only to be able to talk to him, so impromptu, but because it got onto YouTube and it got in the papers and all over the news, David Davis was cornered by the nurses. And I fought with everything that I had, and we won, and it's fantastic.
I wish you luck in your campaign.
Don't back down. Don't ever back down.